non-profit news agency. It was set up in 1999 to actually improve the healthcare coverage in the media. Our health citizen journalism, basically, why did we actually started? We saw that patient advocacy, we were just tired of seeing the terrible terrible public health service delivery. You know, and another thing was, the most important thing was, at the same time when the minister was announcing the rollout of the national health insurance. So we wanted to actually go into the crowd and actually find out what was happening in these national health insurance private sites. So how does the project work? Basically, the citizen journalists on a Monday, every Monday, they would send the story diaries. So they would say, these are some of the stories that I want to work on. And then on Thursday, the stories would be sent to a sub-editor. Then the story also comes back then to me, which I'm our health manager. And then I check for such things such as accuracy, things around ethics, before we actually it gets published on our website. China, who lives in the Eastern Cape, they just recently came back from the training. So in 2012, we started training them for the 5 pilot districts. So when we trained them, they went back to the districts. And when China went back to the district, he first wrote a story about the village clinic in the Sikisiki. Basically, the Department of Health was renting a clinic in the Eastern Cape, a building. So now they were failing to pay rent, which is about 6,000 rent, you know. And now they were actually being chased out, and they were actually now serving their clients into a tent. Remember that story? Yeah. And actually, it was actually China who actually broke the village story. So when China broke the story, Treatment Action Campaign, Section 27 picked that story up, and they wanted to form a campaign around it. Just recently, in July, Sinamile, one of our citizen journalists in Mpumalanga, was just going to ML hospital to visit a friend. And then she found out actually there was no food in the hospital. And certain patients were being contacted to bring their own food. So it was quite a difficult story to do, so I had to actually go down and actually assist her to actually do the story, because there was a lot of tendering process. With the story, we broke the story, but we're following up because we found that there's actually a lot of, there's a tender problem, because the reason why the MLO hospital couldn't, there's no food, is because of they haven't paid suppliers. But what we found is that the tender, actually, they have given the tender to a new person who's actually charging the hospital, like one apple, they will charge 5 rand. So these are some of the problems that the hospital is experiencing. The star was interested in the story, so we wrote the story, it went on to the star. What we also followed was the medical male circumcision. So we decided, okay, we just want to track how is the Department of Health doing when it comes to the NMC rollout in basically 4 provinces. We said Free State, the Northwest, and Mpumalanga. We didn't actually choose which we just said anyone, but the people that we talked about, it was Free State, Mpumalanga, and the Northwest. And I mean, they were visiting clinics, and they were finding that schoolboys were queuing outside the clinic to actually access the NMC. But it was interesting, what we were seeing was that while a lot of young boys were flocking into the clinics, actually certain provinces like Mpumalanga didn't have enough nurses and doctors to actually cater. So, while the Department of Health was saying, yeah, we're doing an NMC campaign, but do we have enough capacity to carry those numbers? So it was interesting. Then we broke the story of Mpumalanga, even though we got Sinamile broke the story about MLO Hospital not having enough doctors to do the NMC. We got into trouble again. She got into trouble again for that. The Department of Health was denying that. But it was interesting. The Nursing Council after that gave the Department of Health permission to allow certain professional nurses to actually perform the NMC under this doctor supervision. We covered that too, because the department said to us, you guys did a story about us not having enough kids. Therefore, we're trying this, so can you guys cover it? So we covered that.